There is another amendment at the desk. The clerk will report the amendment.
Franson moves to amend House File Number 2414, the first and Grossman as amended. The amendment is coded A114.
The member from Douglas, Representative Franson.
Thank you, Madam Speaker and members. You know, as I was flipping through the 12-pound omnibus bill, a bill that, like I have stated earlier, raises the cost of health care, cuts funding to nursing homes, and allows the rampant fraud to continue in the child care assistance program, I looked. The A114 amendment was needed. This amendment requires periodic data matching with the Department of Revenue for child care centers and employees receiving the child care assistance program payments to look for discrepancies between information provided to the county or state for the CCAP eligibility and what is reported to the Department of Revenue for taxes. This language does give the CCAP beneficiaries time to provide additional information to address any discrepancies, but requires the CCAP payments to be terminated if the family does not respond or fails to provide a reasonable explanation. I think when you go home, you can explain this to your taxpayers and they will be happy with your green vote. As reviewed by the OLA report on CCAP fraud, one form of fraud involves employment fraud where the child care centers falsified pay stubs and documents to make it appear to authorities that the mothers were working more hours than actually worked. And the centers would pocket the difference between what they paid in wages and what was repaid or paid through CCAP. There have also been allegations of fraudulent centers that are nothing more than a shell providing no actual services but only exist on paper. And with that, Madam Speaker, I'd like a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Carlson. Representative Carlson.
Under Rule 4.03, I'd like to raise a point of order. There are some large upfront costs to the amendment, and therefore it would violate the House budget resolution.
Representative Carlson raises a point of order under Rule 4.03.
Advice, Madam Speaker.
Representative Dept, state your advice.
Thank you, Madam Speaker. I think this is a situation where there is a problem. We've got an ability here to fix this problem. This is actually going to save money. When we do this periodic data matching, we find out when there's fraud. This will actually save money. So the bill will be out of balance, but it'll be out of balance for the good. In fact, if we could get a fiscal note quick before this afternoon, we could probably figure out how to spend this money real quick in the bill. Maybe the bill spends enough already. Maybe we could find $68 million and we wouldn't have to cut nursing homes. Maybe we wouldn't have to raise health care costs for Minnesotans. Or maybe we could find ways to, curb the other fraud and abuse that's in this bill. But the reality is, this actually is going to save money. So it doesn't, it's not going to cost money. It's actually going to save money. And that's why this doesn't violate 4.03. So, Madam Speaker, I would recommend that you find this point of order not well taken. Let's proceed with this amendment, and let's see if we can do something to save some money so we don't have to cut nursing homes.
Representative Carlson.
Madam Speaker, members, as I mentioned, it's the upfront costs that violate the House budget resolution, and therefore it should be ruled out of order.
Representative Carlson raised a point of order. I have listened to advice from Representatives Dept and Representative Carlson, and I find the point of order is well taken.
Madam Speaker, I appeal the ruling of the Speaker and request a roll call vote.
Representative Dept appeals the ruling of the Speaker. Seeing 15 hands, there will be a roll call. Advice to the body. Representative Dept.
Thank you, Madam Speaker. Members, just what I said to the Speaker, this is an important issue. This is actually going to save money, and I think we have an obligation, particularly in a bill at a time where, we have a $1 billion surplus in our state's budget, and somehow, I actually have it here. In case you were wondering what 1,100 pages looks like, this is 1,100 pages. This is this bill. 1,200 pages? 12 pounds. 1,100 pages. By the way, this is the largest bill that will ever be passed by the legislature in the state of Minnesota. Okay? And somehow, when we have a $1 billion surplus, Democrats have still found a way to cut nursing homes by $68 million in this bill. They're going to break every campaign promise they made and raise health care costs in this bill. And we're doing almost nothing to stop the rampant fraud that's in DHS. And thank you, Representative Franzen and others who have brought amendments forward to try to curb that fraud. I think it's just absolutely the wrong thing to do to go back to taxpayers, and I know this bill doesn't, actually it does, doesn't it? With the provider tax. Why did I think you'd have a bill that wouldn't raise taxes? What was I thinking? You know, at a time when we're already, by some cases, the highest tax state in the nation. The highest tax state in the nation. And we're going to raise more taxes. And at the same time, we got a $1 billion surplus. We're going to raise $12 billion of new taxes over the next 4 years. And somehow we're going to, on top of those tax increases, we're going to raise health care costs for Minnesotans. And you're still cutting nursing homes in this bill by $68 million. You all should be thanking Representative Franzen for finding some savings in this bill that we could then use to lessen these cuts to nursing homes. I'm afraid of the number of nursing homes that are going to have to close in the state of Minnesota and the amount of our loved ones that won't get the care that they need because of this bill. And I think we've got an opportunity, you know, this isn't a violation of 4.03. This doesn't make the bill out of balance. It actually is going to provide you some revenue within the bill that you can use to lessen these cuts, these drastic cuts to nursing homes. So it's really clear. There's no violation of 4.03 here. I don't know what the adversity is to cutting out some of this fraud. I think we owe it to the taxpayers. Instead of going back to the well, that's the easy thing to do. The tough thing to do sometimes is just roll up your sleeves and try to figure out how do we use the resources that Minnesotans have already given us? How do we use that stuff better? Somebody's calling. How do we use that stuff better and more effectively and more efficiently to do a better job for Minnesotans, to provide better service? Instead, it's always go back to the well, go back to the taxpayers. Let's just tax them a little more. Some would say, best case scenario, we're the fifth, for you, best case scenario, we're the fifth highest tax state in the nation. Some would say fourth. Some have analyzed all the taxes and say we are the highest tax state in the nation. You wonder why, at a time when our economy is booming, when wages are going up, when unemployment's at a 30-year low, and other states' economies are just literally booming, and somehow we lost $500 million of revenue from November of last year to February of this year. And you want to go back to the taxpayers and increase taxes on Minnesotans. I can't wait till we get to the tax bill and we start talking about the tax incidence study. We have a long-term problem here. And if you don't see the beginning signs of it, they showed up in our February forecast. If you don't see the beginning signs of that, of what's happening on the horizon, we're going to have a huge deficit coming. We've got to make corrections now, or we're going to drive more people out of the state, we're going to have less revenue, a bigger deficit, and you're going to have huge problems. And this is just one small step. So thank you, Representative Franzen, for bringing this forward, because I could never go back to the taxpayers and ask for one dime more, knowing that I haven't done everything that I can to curb any waste, fraud, and abuse in our public programs. So, Representative Franzen, this is the right thing to do. This doesn't make the bill out of balance. It actually creates more revenue in the bill that we can then use to, I mean, many other things, but we can certainly reduce these drastic cuts to nursing homes. And maybe we could, put some other things in this bill that would reduce some of the other rampant fraud that continues. And my hope is by the end of this, we'll get to some amendments that will hopefully make it so we're not raising the cost of health care for all Minnesotans. This is just a small thing we can do on this one amendment. But let's not let the rules get in our way again, or use the rules to block us from doing something that makes common sense. This is very clearly not a violation of our rule. This one actually is going to create revenue within the bill that you can use in other areas. So let's not miss an opportunity. It's no wonder that you have to cut funding to nursing homes in the bill, because you didn't even look for the revenue that you had in the bill. You got a lot of money sitting in DHS. I would guess there's maybe even as much as $500 million in DHS of waste, fraud, and abuse. Why don't we use that and not cut nursing homes $68 million? That to me sounds like a better idea. And you know what? I know it's not always easy, but we didn't get elected here to do easy stuff. We got elected to do what's right. And this amendment's what's right. Please vote to overrule the speaker. Let's take up the amendment, let's pass it, and then you can all figure out where to spend the money. But hopefully you use the money to stop these cuts to nursing homes.
Members, a reminder, we are on the appealing of the ruling of the Speaker. The question before the body is, shall the decision of the Speaker stand as a judgment of the House? A yes or a green vote supports the ruling of the Speaker. A no or a red vote goes against the ruling of the Speaker. Representative Zerwas.
Advice to the body, Madam Speaker.
State your advice to the body.
Thank you, Madam Speaker. Members, I would invite you to look at not only this February's forecast, but the forecast from the fall and last February's forecast and the forecast from the fall before that. And what you will find is the MMB note that of the lost revenue because of the delay in the periodic data matching from our public programs. Now, periodic data matching for many public programs was implemented just in January, and the Department of Human Services provided that information back to our committees that showed tens of millions of dollars a month in savings just by taking already available Minnesota Department of Revenue data and comparing that to what people put on their forms when they apply for public programs. We have an open arms and an open heart in Minnesota to take care of people that need the help. But I think it's worth just kind of, double checking. Because sometimes people write the wrong number on the application and they don't actually qualify for the public program that they've applied for. All this amendment would do is have the Department of Revenue double check the income that they reported versus the income they wrote down on the statement while they applied for this public program benefit. We're talking tens of millions of dollars that could be recovered on just people who don't flat meet the bare minimums to qualify for this program. And so, members, you have a bill before you that raises the cost of health care, cuts nursing homes by $68 million state dollars, over $130 million when you count the federal match. It doesn't do enough to crack down on the rampant waste, fraud, and abuse. And so, members, I'll give you advice. As you go door to door to door in your districts, and you knock when they ask you, what did you do about fraud and waste? You better be able to say, we at least double-checked the application. Because that's what this vote is for. Members, it's time to overrule the ruling of the Speaker.
Advice to the body, Representative Albright.
Thank you, Madam Chair. The irony on this one for me is a bit bizarre because we heard a motion from Representative that Representative Dabney responded to not too long ago, where he said we wanted to re-refer the Ed Finance bill back to Ways and Means. And Representative Dabney said that this body doesn't dabble in speculation. And then furthermore, he said, we rely upon fiscal notes to know whether things cost anything or not. Members, what is Representative Carlson suggesting now? He's saying the point of order is based upon speculation. So which way are you going to go on this one? Do you want speculation, or do you want to run on hard fiscal notes? You can't have it both ways. Make up your mind.
Seeing no further discussion, the clerk will take the roll. Once again, reminder, members, the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. The clerk will take the roll. The clerk will close the roll. Okay. There being 76 ayes and 53 nays, it is the judgment of the House that the decision of the Speaker shall stand. There is an amendment at the desk. The clerk will report the amendment.
Franzen moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A-184.
Representative Franzen, to your amendment.
Thank you, Madam Speaker and members. Well, I'm very disappointed. I'm very disappointed that we could not continue on with the conversation of that last amendment, that it was overruled by some rule in the book. So here we are, still talking about a bill that allows rampant fraud to continue. And that vote to uphold the ruling of the Speaker allows that fraud to continue. So let's try with this. On the A, is it 163? Which one are we on? 184, hold on.
Representative Franzen, we are on the A-184 amendment.
All right, here we are. This amendment prohibits providers with a history of overpayments, fraud investigations, disqualifications, or as part of an ongoing fraud investigation from receiving the child care assistance payment rate increase as provided for this bill. Did you know there's fraud, rampant fraud in the child care assistance program? And the majority in this body, the Democrats, have increased the funding in the child care assistance program. I have not met any taxpayer in my district that said, please put more money into this program that is riddled with fraud. The CCAP provider rate increase in this bill should be reserved for providers in good standing. There are serious concerns with this program, friends, and taxpayers have every right to be suspicious of dumping millions of dollars of additional money in a program with a fraud rate that could be 7% or higher based on the own external review paid for by the department. Madam Speaker, I request a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Discussion. Representative Pinto.
Thank you, Madam Speaker. So I very much enjoyed working with Representative Franson on the committee. I've gotten to know her much better, which I've appreciated. But I got to tell you, this amendment, well, let's just talk about it. So what this amendment says is that when there are concerns about a provider, so we're concerned that a provider might be somebody who might be committing wrongdoing, have the chance of doing that, whatever it is, what we're going to do is we're going to leave them in the program. We're just going to pay them a little less. That makes no sense to me, okay? Providers, if we have concerns about them, let's hold them accountable. Let's identify the concerns. Let's do the 5 steps we talked about, right? Identify the concerns. Let's investigate. Let's pursue that. Let's hold them accountable. Let's pursue consequences. Let's prevent. Let's have transparency. But the one thing I don't think makes a lot of sense is to say we're concerned about a provider and we're going to leave them in and just pay them a little less. So members, yeah, no, vote this down. Thank you.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 53 ayes and 76 nays, the motion does not prevail and the amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Franson moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A183.
Representative Franson, to your amendment.
Thank you, Madam Speaker. Members, the A183 amendment transfers the Office of Inspector General out of the Department of Human Services and sets it apart as a standalone agency free from the political interference and gross mismanagement of the Department of Human Services. Additionally, this amendment spins off the recipient and child care provider investigation units from DHS and transfers them to the Bureau of Criminal Apprehension to create a statewide fraud investigations unit within the B.C.A. These transfers are conducted in 2 phases, with the statewide fraud investigations unit being established as of January 1st, 2020, and the standalone OIG established as of January 1st, 2021. These timelines provide time for the necessary transitions. Members, it is no secret that the OIG under the previous administration, Mr. Speaker, could you, it's getting a little loud in here.
Members, please take your conversations off the House floor. Representative Franson.
Thank you. So as I was stating, now that it's quieted down in this lovely chamber, it is no secret that the OIG is under the previous administration, particularly the Fraud Investigations Unit, have been horribly mismanaged and hampered in their efforts. The Inspector General, Carolyn Ham, has been placed on investigative leave, and her return is questionable. And thanks to the efforts of the DFL majority to shield her away from any oversight by either the Early Childhood Education Division or the Health and Human Services Committee, we may never, ever hear from her or get any explanations what was happening under her management. I had originally thought to move the OIG as a standalone entity and even considered moving the entire OIG into the B.C.A. But after reviewing the matter with the Commissioner of the Department of Public Safety and the Superintendent of the B.C.A., I believe this approach is better. One thing is for sure, we need a statewide fraud investigations unit, and the B.C.A. is the most qualified and logical entity to oversee this unit. And the OIG needs to be free from political outside influences. It needs to be separate and independent. It's also one of the recommendations in the OLA review. And with that, Mr. Speaker, I would love to have a roll call.
Do I see 15 hands? Seeing 15 hands, there will be a roll call. There's an amendment to the amendment at the desk. The clerk will report the amendment to the amendment.
Mr. Speaker,
Representative Carlson.
I'd like to raise a point of order under Rule 4.03. That seems to be the rule of the day. This establishes the Office of Inspector General, transfers employees, and there are some costs inherent in the amendment that are not accounted for. So, Mr. Speaker, I would encourage you to rule the point of order well taken.
Representative Carlson has ruled a point of order on Rule 4.03. Advice.
Advice.
Advice, Representative Franson.
Mr. Speaker, current law allows for the transfer of money to travel with them, so there would be no fiscal costs.
Any further advice? Representative Pinto.
Thank you, Mr. Speaker. Mr. Speaker, there would be advice, if I may. There would be the cost that would be incurred in the transfer itself. I should note that this would very likely be out of order under another provision as well, since it would transfer between departments and relating to government operations. I guess we could get there if necessary. So I would be out of order on that as well, but I'd urge you to find the point of order well taken. Thank you.
The speaker's heard advice on a point of order on Rule 4.03. Rule the point of order is well taken.
Mr. Speaker. Mr. Speaker, I would appeal the ruling of the chair and ask for a roll call, please.
I see 15 hands. Seeing 15 hands, there will be a roll call. Appeal of the chair. So the question before the body, shall the decision of the speaker stand as the judgment of the House? Representative New.
Thank you, Mr. Speaker. And advice to the body, under state statute, there is already a standard procedure in place for this. This does not incur additional costs. This already exists in statute. I would ask for your support in appealing the ruling of the chair.
See no discussion. A yes or a green vote upholds the ruling of the speaker. A red or no vote goes against the ruling of the speaker. The clerk will take the roll. The clerk will close the roll. There being 74 ayes and 54 nays, the decision of the Speaker shall stand. There's another amendment at the desk. Representative Franson offers the following amendment. The clerk will report the amendment.
Franson moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A181.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker and members. Trying not to take that last amendment personally, but that was a really, really bad thing to do. The A181 amendment addresses the fraud rampant in the child care assistance in this state by investing more money into the investigators at the Office of Inspector General and providing grants to counties to improve their own fraud investigations. As I said, we currently are discussing a 12-pound omnibus bill that raises the cost of health care, cuts nursing home funding, and allows for the rampant fraud to continue. Well, maybe this amendment here, maybe just this one amendment, you'll vote for it, and you'll be able to tell your people back home that you did one small minor thing. We know that counties don't have the resources to combat fraud, and we have the money here to address the issue. Instead of putting money into expanding the fraud-riddled child care assistance program, let's spend that money we already have put toward that program. If and when we uncover fraudsters, they will be removed from the program and people on waiting lists will get their place. We can address fraud and address the wait list. Members, we have got to treat fraud like the serious issue it is, and we have got to put enough resources towards addressing the problem. And yes, Mr. Speaker, I request a roll call.
Do I see 15 hands? Seeing 15 hands, there will be a roll call. Discussion to the A181 amendment. The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. So, members, this amendment would add staff and would increase a county grant program. Well, that's exactly what the bill does. And maybe this is a good time to just respond to the point Representative Zerwas made. He said that when you're out door knocking and you're asked what you did, you want to be able to say what you did. And members, when you vote green for this bill as a whole, if you do, you will have voted to add staff to have that electronic billing and attendance system, to add staff for data analytics, for fraud investigators, both at the Department of Human Services and the Bureau of Criminal Apprehension as well, to expand this county grant program. And heck, I'm missing several other personnel as well. So many different people. The problem with this is, and perhaps the thinking is, having done some of that, we're just going to keep on doing some more. Well, members, the problem is we have children who are on a waiting list and families who are waiting to receive the child care assistance they need to be able to enter the workforce, to not be dependent on public programs, to be able to move forward. And at the same time, we have providers who are getting low rates. So what are we doing? We are investing a lot in identifying, investigating, going after misuse of funds. We are going after it hard. And if you choose to vote for this bill in the end, you will be voting in support of that. And at the same time, we are lifting up providers. We are lifting up children. We are lifting up families. We can do both, members. We must do both. The bill does both. Members, vote down this amendment, because we need to get those kids off the waiting list and increase payment rates, even at the same time as we are doing the 5 steps I talked about before: identifying, investigating, consequences, prevention, transparency, etc. Vote red. Thank you, Mr. Speaker.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker and members. I'd like to refer you to page 5 of the Child Care Assistance Program Assessment of Fraud Allegations. On page 5, on the second sentence, on the other hand, we believe the level of the CCAP fraud is more than the $5 to $6 million that prosecutors have been able to prove. but we cannot offer a reliable estimate of how much fraud exists in the program. Members, vote green.
Representative Pinto.
Thank you, Mr. Speaker. Well, as long as we're at it, right, of course, there's a lot that is that this bill goes after to make sure that funds are being used well. And at the same time, let's face it, this comes out of allegations that were in fact found to not be substantiated regarding the program. So is there misuse of funds? Yes, that there are misuse of funds. I would not have a job as a prosecutor if that was not the case. And are there families that are needing support on this program and there are providers who are being paid low rates? That is true as well. Members, I'd urge you to vote the amendment down, and I certainly would urge you to vote in favor of the bill if, in fact, you want to go after the misuse of funds. You're going to be going after and supporting that long list that I described before. Let's vote this down. Thank you, Mr. Speaker.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker. Members, I will refer you to page 11 of the OLA report. First sentence, DHS officials do not dispute that the CCAP fraud is a serious problem. Vote green.
See no further discussion. The clerk will take the roll on the A-181 amendment. Clerk will close the roll. There being 55 ayes and 73 nays, the motion does not prevail. The A-181 amendment is not adopted. There's an amendment at the desk. Representative Heinsman offers the following amendment. The clerk will report the amendment.
Heinsman moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A-166.
The member from Crow Wing, Representative Heitzman.
Thank you, Mr. Chair. Mr. Speaker. So this bill, it does a number of things. We've heard a lot about some of the concerns raised relative to raising health care costs, cutting funding for nursing homes, and now we're on to the issue of fraud. I have an amendment that I think adds some value back, and I hope that members can support it. Chair Pinto, you ran a pretty good committee. I enjoyed my time on early childhood. I had previously thought that I might be again on higher ed, but early childhood was in the cards, and I enjoyed it thoroughly. One of the things we heard about was the North Star Care for Children program, and this amendment redirects $27 million from the CCAP basic sliding fee waiting list reduction to fund a rate increase for children under the age of 6, supported through the North Star Care for Children program. We don't know the full extent of the fraud within the Child Care Assistance Program, but we do know that the North Star Care for Children program is important for thousands of children and those families so generously providing them a safe and loving home. In the committee, we passed HF 1653, which provided a rate increase for children under the age of 6 in this program, but provided no funding for that bill. We heard powerful testimony, which I'm sure all the members of the committee remember, and I'm assuming, I think correctly, that most of the folks that are here today, members, would agree if they had heard that same testimony that this program is important and serves some of the most vulnerable among us. Another point I was going to quickly mention, because I am assuming that Chair Pinto may rise. We had a pretty interesting discussion early on. Few of the first meetings included a conversation around the title of a certain omnibus bill. And I'm guessing that there may be some more of that going on. I know I'm hearing a few suggestions, and we're hearing about a 12-pound bill. But 1,100 pages, I'm thinking that might be Maximus Omnibus, Chair Pinto, but maybe you've been hearing different things than what I've heard. So, members, I would appreciate support on this amendment.
The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker, and I certainly enjoyed working with Representative Heinzman as well. Though I guess I have to say, and you won't be surprised by this, I have the same reaction to this now that I did in committee, and I was pretty clear about it, that I view this as being quite cynical. I have a very challenging reaction to this, I guess. So what this does is it ends up pitting one group of vulnerable kids against another group of vulnerable kids. Again, we have certainly concerns to make sure that funds are being used well in all of our programs. Those who are hurt the most by funds that are being misused are those who are the kids and families who are so reliant on them, and they are kids and families in very difficult situations trying to move themselves into the workforce. That's what this is related to, or school. And absolutely, we need to then be supporting the children who are in North Star Care and children who are experiencing those vulnerabilities as well. But to put them against one another is a choice that I reject. Again, members, we can address concerns of misuse. The bill does that in 5 areas. And at the same time, we can make sure that providers receive fairer rates that will actually be able to keep them going in this business, and that kids and families can be taken off the waiting list. So I would urge the members, with respect, urge that they vote this down. Thank you, Mr. Speaker.
The representative from Crow Wing, Representative Heinzman.
Thank you, Mr. Speaker. Again, I'm, I guess, frustrated because I see so many things happening in this bill. Once again, it's raising healthcare costs, cutting fund for nursing homes. I think we heard the total here, $68 million in cuts this bill offers to nursing homes. And fraud is not being taken seriously, in my opinion. And I think the description of this particular amendment as being cynical, I think, isn't correct either. I think that, and I'm here again, I can assume other members saw hundreds of emails and phone calls the way I did from people very concerned about what's happening in CCAP. And I think that the response shouldn't be to increase funding in a program that's got so many question marks around it, especially as these amendments are being voted down one after another or ruled out of order. So I would request a green vote, and I would request a roll call, Mr. Speaker.
Roll call's been requested. Do I see 15 hands? Seeing 15 hands, there will be a roll call. Further discussion on the A-166 amendment. The member from Clearwater, Representative Grosso.
Thank you, Mr. Speaker. And I rise on behalf of supporting this amendment. Again, it's been stated over and over and over again, the facts about this bill. It will raise health care costs, something that you said you wouldn't do. We'll cut funding for nursing homes to the tune of about $68 million. Another thing that you campaigned that you wouldn't do. It will allow rampant fraud to continue in CCAP. You talk about holding people accountable, and yet you're going to increase the money going into CCAP. If you held the people accountable and made sure things were done right, you could make do with the money that's already there. The millions of dollars that are lost to this fraud, it's shameful. Now, the only reason I stand up on this topic is because you have groups of children waiting. Representative Pinto, you're right. You have groups of children waiting. But if we held people accountable for their actions, that money wouldn't have gone wasted. That money wouldn't have been diverted to other places where it shouldn't have been, where it wasn't supposed to be. And we've got more children that are waiting. The funds that were wasted could have gone to another child's program, so you wouldn't be pitting anybody against anybody. There would be good resources to cover both, all these children. So you're not pitting anybody against anybody by holding people accountable who are stealing state funds. Stealing your tax dollars, my tax dollars. It's ridiculous. You know, and I find it hard, you know, I listened to Representative Pinto, I listened to you talking about all the things that the bill is supposed to do. But I take that with a grain of salt from what I've seen in the committees that I've been in, where more and more people are being allowed to continue to go down a path of not being held accountable, not keeping themselves accountable, and holding their feet to the fire as far as crimes that are committed. So it's a tough pill for me to swallow when somebody says, well, we're going to do this, we're going to do that, but all the actions I've seen, and I'm talking about public safety, and that's going to be coming soon, where I've seen so many things come through there where nobody wants to be held accountable. Nobody wants to hold somebody accountable for their actions. They want to become enablers. Let's keep people heading down the wrong path. Now we've got an opportunity to make sure that this stuff is done right. I'm sick of people having their health care costs skyrocket on them. Keeps raising. I'm sick of having our elderly suffer because, hey, it makes it sound like, you know, what you want to do here is we don't care about the elderly. We don't care about the people in nursing homes because we're going to cut their funding. And by the small measures or the very anemic measures that you're taking on the CCAP fraud, it will allow rampant fraud to continue. Oh, and by the way, let's give them some more money to use in fraudulent ways. Let's take some actions and start bringing people to the table of accountability and holding them for what they've done wrong so that we don't have to waste these funds. We don't have these funds going elsewhere. We don't have to talk about pitting children who need help against each other, because if we made sure things were done right to begin with, we wouldn't have to have this conversation because the funds would be there for both. I would say we should go green on this and support this amendment.
Any further discussion on the A-166 amendment? Not, the clerk will take the roll. Members, please vote. The clerk will close the roll. There being 52 yeas and 74 nays, the motion does not prevail. The A-166 amendment is not adopted. There's another amendment at the desk. Representative Zerwas offers the following amendment. The clerk will report the amendment.
Zerwas moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A99.
The member for Sherburne, Representative Zerwas.
Thank you, Mr. Speaker and members. Members, the A99 amendment deals with daycare fraud again, but this looks at it a little bit differently in recovering potential losses. And so it has large-scale child care assistance program participants, requires them to carry a $250,000 surety bond or a $100,000 surety bond if they take in more than $250,000 in CCAP revenue annually. And so what we have seen and heard from investigators and prosecutors is oftentimes when fraud is detected and when we're able to prove that fraud has occurred, those that are suspected in being complicit in the fraud, in some instances, have fled the country, or in other instances, have closed down the business and the operation, and there's no ability for the state to recover the lost assets. And so what this would do is require the surety bond to be recovered and would allow, when fraud is found and proven, that our losses can be recovered. So this is a taxpayer protection program. I urge a green vote.
The member from Hennepin, Representative Carlson.
Mr. Speaker, I think the body probably can pretty well guess which rule I might be referencing, 4.03. The amendment would add additional costs and therefore violate the House budget resolution. And so I would request that it be ruled out of order.
Representative Carlson has brought forward point of order on Rule 4.03. The member from Sherburne, Representative Zerwas. Advice.
Advice, Mr. Speaker. Members, I understand that leadership among both parties discussed moving things along and treating each other with respect and having respectful dialogue and debate, and perhaps not dragging things out and being respectful of people's time and weekend. However, Mr. Speaker, if we're at the point where an amendment for a policy provision that doesn't ask for an expenditure, doesn't ask for another program, doesn't ask for anything to be done by a state agency, if we are now at the point where we're going to start ruling that out of order because the majority doesn't want to take the vote, well, Mr. Speaker, it is going to be a long, long night, and it is going to be a long, long weekend. It is going to be a long, long next week. Mr. Speaker, you can avoid these votes today. You can avoid the debate today, but I promise you, if you are unwilling to address these issues and debate them and vote them, you will not be able to avoid this debate forever. This will follow you. If you are unwilling to have the debate that says if we catch someone and prove that they are fraudulently stealing taxpayer dollar from the state of Minnesota, And so we're going to go after a privately issued surety bond to recover our loss. If you're unwilling to take that step or even have the debate, well then, members, we are in for a long May. Advice, Mr. Speaker, there is no expenditure in this amendment. This amendment does not require the agency to do a thing. This amendment requires a private child care provider to get a private surety bond through a private surety bond agency, a thing, Mr. Speaker, that we require of other providers in other public programs. Advice, Mr. Speaker, is to find this point of order not well taken.
Representative Dept.
Thank you, Mr. Speaker. I know this is a little unconventional. We actually did it here earlier. We're not supposed to do it, but I wonder if I might just ask Representative Carlson a question, if you'd allow that. Maybe we could just figure out a way to get to the bottom of this and move on.
You're asking Representative
If he would
Carlson to
yield.
yield? Representative Carlson will yield. Representative Dept.
Thank you, Mr. Speaker. Representative Carlson, or Mr. Chairman, I've read through this. I think Representative Zerwas is right. I think I had a conversation with your leadership, who's not in the chamber right now, last night about not having such a tight strike zone on these, and maybe it's easier if we just take a vote and we can move on fairly quickly. This doesn't seem like that big of a deal. I read this, I don't see a cost to the state or a state agency. Maybe you can tell me where you do, or maybe you would just consider withdrawing your point of order and we can not have a long discussion and just move on.
Representative Carlson.
Mr. Speaker, Representative Dept, since I've been the one that has been raising the point of order 4.03, but I think in terms of respecting the minority caucus, I've been very careful to just raise the point of order based on the rules. But I would remind the caucus, whether you're in the majority or whether we are, once the Ways and Means Committee passes the budget resolution, we're bound by that resolution here on the House floor. I did check with Representative Pinto a few moments ago to ask if some of the amendments dealing with child care, if there had been a fiscal note or if there had been hearings on any of those bills, and he indicated that he didn't recall that there had been any hearings or fiscal notes relative to some of the earlier amendments. The one that's before us now, Representative Dept, I do have a communication from the department. It is not a fiscal note, but then when you're dealing with amendments on the House floor, it's sometimes difficult to get a fiscal note as quickly as we would sometimes like. But the key sentence here, when we evaluated a similar requirement in the past, we estimated systems costs to be about $380,000 one time and ongoing maintenance costs of $60,000. So there clearly is a cost to the amendment. And so as Chair of Ways and Means, as the one who authored the budget resolution, and just a few days ago when we were addressing some other issues, offered in Ways and Means amendments to the budget resolution, which is where we take care of that kind of business. We did make appropriate adjustments at that point in time. So out here on the House floor, it is sometimes a judgment call as to what the exact cost would be. That question did come up earlier, and I think in the discussion it was pointed out that there was in fact a cost. We didn't know what the cost was, but there was a cost that would have put it in violation of the budget resolution. So this one here does in fact have a cost, and so I would continue to raise the point of order 4.03.
Advice.
Thank you, Mr. Speaker, and thank you, Representative Carlson. Maybe you can share that communication that you have. I understand it's not a fiscal note. I also understand how this works. You have been here a little longer than I have, and you are the chair of the Ways and Means Committee, and I assume that you know as well as I do that when you mention the name of an agency, they will tell you that costs money. Because that's, their job is to get a higher appropriation out of the legislature. But I think we ultimately have to make the decision on whether this stuff costs money. This one, I think your strike zone is a little too tight. I'm going to talk with your leadership here as soon as I'm done and talk about having a little better spirit of let's just move along quickly and not have such a tight strike zone. So, Mr. Speaker, I assure you this has all been advice to you. So I would appreciate if you would call this point of order not well taken.
Further advice. Member
Mr.
from
Speaker,
Hennepin, Representative Carlson.
after consulting with the majority leader, I withdraw the amendment, or the point of order.
The Carlson point of order is withdrawn to the amendment, the A99 amendment. The member from Sherburne, Representative Zerwas.
Thank you, Majority Leader Winkler, and thank you, Chair Carlson.
The member from Ramsey, Representative Pinto. Representative Zerwas.
Thank you, Mr. Speaker and members. Again, for everyone's clarification, this is requiring a private CCAP provider, a child care center, that takes in more than $250,000 of taxpayer dollars a year in CCAP funds. So that there is not that many daycare centers. And what we're saying is have those centers get, through a private company, a surety bond so that if fraud is detected and if there is course to recoup taxpayer dollars, that there is bond money there for taxpayers to recover. That's what the amendment does, and that's the gist of the amendment. Mr. Speaker, I'd ask for a roll call vote on the amendment.
Roll call's been called for. Seeing 15 hands, there will be a roll call. Representative Zerwas. The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, I rise in opposition to the amendment. And I think it's just important for us to be really having in our minds the extremely thin or really negative margins that we're talking about for the businesses in question here. Childcare is expensive because caring for children is expensive. There are not economies of scale involved. You can't have a 20-to-1 a child to a provider ratio. We're talking about extremely thin margins, again, if any money's being made at all. We're talking about a situation where we're asking this private provider then go out and get this surety bond. And I have not seen, perhaps there is some specific recommendation regarding this that is in the that would show this is some problem that's being solved. Members, we have got a bill that has a ton of steps that are being taken to address misuse of funds. All that this would do is would continue to even further limit the low-paid wages. To be clear, the lowest paid bachelor's degree that somebody can get is in early childhood. Okay, you're going to make more money in poetry and sociology than you will in early childhood. So we're going to be depressing those wages even further and limiting quality and access. Members, I would urge you to vote this down. Thank you.
The member from Wabasha, Representative Driscowski.
Thank you, Mr. Speaker. Would Representative Pinto yield?
Representative Pinto will yield. Representative Driscowski.
Thank you, Mr. Speaker. We're used to Madam Speaker. Thank you, Mr. Speaker. Representative Pinto, I found your comments very interesting. Can you tell us about the trend in daycare providers? Which types of daycare providers are growing and which ones are dying?
Representative Pinto.
Thank you, Mr. Speaker. Well, of course, there's struggling providers all throughout our economy. We've certainly lost many more family child care providers than child care centers. There's been a slight growth in that. I should note that that is true nationwide, not just in the state of Minnesota. Thank you. And in Wisconsin in particular, among many other states. Thank you.
Representative Drazkowski.
Thank you, Mr. Speaker. And Representative Pinto, you're right. We've lost 4,000 family daycare providers here in Minnesota since Parent Aware and all these stringent regulations were put in place for the small child care providers who are bearing the brunt of the inspections and investigations from the Department of Human Services. Meanwhile, the corporate daycares have been growing exponentially around the country and in Minnesota. And Representative Pinto, Representative Zerwas's amendment focuses on the larger daycare providers, the ones that get lots and lots of CCAP dollars. So, Representative Pinto, your argument is a reciprocal of that, and it doesn't hold water here. The reality is, the trend is, the small daycares are getting pummeled, and the large corporate ones are growing, and they're getting fatter and fatter and delivering more and more campaign contributions to organizations in Minnesota and throughout the country in order to bring forward their accentuated growth. So that's the reality. I appreciate Representative Zerwas's amendment. I wish the Democrats would stop closing their eyes to daycare fraud. Now, this is one piece of a puzzle. It's one tool. It's one idea that will actually start to close in on accountability and responsibility with this program that has been labeled by the Office of the Legislative Auditor to be so porous in its controls that many people have said that if you are going to steal money from the people of Minnesota, open a daycare. That's what you do if you want to take other people's money in this state. Well, of course, you know, vote for Democrats, but open a daycare. That's how you do it. So thank you, Mr. Speaker. Thank you, Representative Zerwas, for bringing the amendment.
Any further discussion on the A99 amendment? The member from Dakota, Representative Garofalo.
Thank you, Mr. Speaker. Just if Representative Pinto would yield for just a couple of quick questions.
He will yield. Representative Garofalo.
Mr. Speaker, Representative Pinto, you're known as one of the leaders in the DFL caucus on the issues of child care. I assume that you are familiar with the Office of the Legislative Auditor report on this issue. Have you had the opportunity to read that?
Representative Pinto.
There are actually two reports, and I had the opportunity to read both, Representative Garofalo.
Representative Garofalo.
Mr. Speaker, Representative Pinto, if you'd yield for another question.
Representative Pinto will yield.
There are references in that report to something called Operation Rhino, and I don't mean Operation Republicans in name only. Do the references to Operation Rhino in that report concern you? And as a leader in the DFL caucus, can you summarize your caucus's position on that?
Representative Pinto.
Thank you, Mr. Speaker. Representative Garofalo, I've actually read a lot of things, and so would you mind just directing me where in the report where you're referencing Operation Rhino? My apologies.
Representative Garofalo.
Mr. Speaker, Representative Pinto, my recollection is it's on page 24 of the report. I think you might find it in the fourth paragraph down. That's my recollection of it. Yeah, Mary, I have it. Mr. Speaker and Representative Pinto, if you just yield for another question.
He will yield.
Thank you. Mr. Speaker, Representative Pinto, many of us on this side of the aisle believe that we have rampant fraud in the child care system. We have runaway fraud in the child care system. There are many points in this Office of the Legislative Auditor report that validates what people on this side of the aisle have thought for a while. Do you believe, and does your caucus believe, that we have a problem with rampant fraud in the child care system in this state?
Representative Pinto.
Mr. Speaker, thank you. Representative Garofalo, I'm now realizing why I didn't recognize the phrase Operation Rhino, because I did read the report, but that came from the entirely discredited allegations regarding there being some kind of link between child care assistance and these overseas activities, et cetera. Right above the phrase Operation Rhino, the auditors say we did not find that child care assistance money was involved in these cases, including Operation Rhino. There obviously, Representative Garofalo, is a concern, and House File 2414, I'll look forward to your green vote on it, takes a lot of strong steps to address that concern. Thank you, Mr. Speaker.
Representative Garofalo.
Thank you. Mr. Speaker, Representative Pinto, well, I would encourage you to continue reading that page where you will find that a federal grand jury indicted in Minneapolis Omar Abdi Mohammed of conspiring and providing material support to foreign terrorist organizations. Also further in that report, we find out that a relative of this gentleman was actually arrested and charged with child care fraud, and when they were bailed out, they skipped bail and left the country. So I would encourage you to continue reading beyond the one paragraph you mentioned, but if Representative Pinto would just yield for one more question.
Representative Pinto will yield. Representative Garofalo.
Thank you, Mr. Speaker. And Representative Pinto, and again, so I'll ask this again, and hopefully I can get an answer this time, but many on this side of the aisle, we believe we have runaway rampant fraud in this program. We believe, and it's validated by the information in this report, that dollars that are supposed to be using to help people be transitioned from welfare to work, that's meant, the generosity of the taxpayers of the state of Minnesota is being used to help people, is instead getting ripped off. You're a leader in your caucus on this issue. What is the DFL and you think about that?
Representative Pinto.
Thank you, Mr. Speaker. Representative Garofalo, so let's be really clear that the auditor's report says none of Minnesota's past, and I'll use the word, terrorism-related cases involved child care assistance program money. None. The Office of Legislative Auditor was very clear on that. And let's be clear, this all came about because of an inflammatory report a year ago that has been found to have no credible evidence to support it. Now, what did come out of it, Representative Garofalo, is some information that, guess what? Sometimes funds are misused. And again, I would not have a job as a prosecutor if that was not the case, if there weren't some kind of wrongdoing in different areas. We are taking many, many steps to address that. And boy, is there serious concern and those steps being taken? Absolutely. And again, I'll look forward to your support of the many steps, and I'm happy to walk through those 5 points again in even greater detail. Representative Garofalo, let's recognize that we have a community, our neighbors, who have been under great scrutiny and have felt great fear because of these allegations over the past year. And then this report comes out and finds that there is no connection, that there was no credible evidence to make that link. And so, Representative Garofalo, I'm disappointed that you'd even go there now, because in fact there is no evidence. And so, are there concerns? Yes, there are, and we're taking steps to address them. Thank you, Mr. Speaker.
Representative Garofalo.
Well, Mr. Speaker and members, we are aware, however, of a sibling relationship between the owner of the Digo Family Center, the Ramsey County case referred to in page 19 of this report, and page A7 of Appendix A, and a man who pleaded guilty to lying to a federal grand jury in connection with Operation Rhino. Dago owner Yasmin Abduli Ali, who jumped bail and never stood trial, is the sister of this individual. We're not imagining this. The reports of this that are coming from investigators that are coming up with close to $100 million of fraud, it's not pretend. And this effort at political correctness or falsely labeling these concerns is just not accurate. And it's not coming from the Republican Party, it's coming from the Office of the Legislative Auditor. So I would hope, members, that we can be aware that taxpayers are getting ripped off right now. There are needy families that are on a waiting list that need this service, that are having the money redirected to con artists and thieves. And we should be doing this, we should be voting for the Zerwas Amendment and do something to stem the rampant fraud in this system. Thank you, Mr. Speaker.
The member from Sherburne, Representative Zerwas.
Thank you, Mr. Speaker, and thank you, members, for the debate on this amendment. Couple just rebuttals to what Representative Pinto talked about, the idea that somehow having a private corporate daycare provider that takes in more than $250,000 of just CCAP funds, somehow getting an surety bond is way too onerous and way too challenging. Members, today, under current state law, MA providers, we require them to have an surety bond. If you're a licensed contractor, if you work on building a house, you have a surety bond. If you install HVAC, you have a surety bond. I just heard from a member who, during college, sold vacuums door to door. She took out a surety bond. Members, let's not make this political. Let's follow common sense. The only thing this amendment says is that we ought to, on behalf of the taxpayer, if we prove a huge daycare center has been committing fraud and stealing taxpayer money, we ought to be able to go back to an surety bond and recover that money for the good of the taxpayer. That's all this amendment does. To try to politicize it or say there isn't a connection to terrorism, we're not talking about that. We're saying if a large daycare center that takes in more than $250,000 of taxpayer dollars is proven to have stolen the money, we ought to be able to recover it. Members, it's so simple, I shouldn't even have to draw you a picture. Push the green button, let's move on.
Any further discussion on the A99 amendment? Representative Hassan.
Thank you, Mr. Speaker and members. I just want to set the record and correct the false narrative that has been echoed in this floor over and over and over. The $100 million report that was false report that Fox 9 reported that the Somali community stole $100 million from child care and sent it to Somalia to help Al-Shabaab. That was false. There is no conclusive evidence for that. So put that in the bank and swallow that pill. Secondly, when you take one report that says someone who committed a crime was related to somebody else, how many people are arrested in this country? 25% of the US population are locked up. So let's all count how many people have committed crimes and find if they're your cousins, if they're your nephews, if they're your nieces, aunts, uncles. Let's do that, please, let's do that. This false narrative, fear-mongering, racist, Islamophobic tactics that the Republicans are using to shame the Somali community is ridiculous. And I am not going to sit here and let you just discredit the whole community. Thank you very much.
Representative Driscowski.
Thank you, Mr. Speaker. Would Representative Hassan yield?
Representative Hassan will not yield. Representative Driscowski.
Well, thank you, Mr. Speaker. Well, I will just say, Representative Hassan, no one talked about any individual race or group of people. I would suggest you read the Legislative Auditor's report, Representative Hassan. There's $6 million of fraud convictions, proven fraud. There's nothing about any individuals other than the names of the individuals who are convicted as public record. It's in the report. 15 different convictions. There's fraud in Minnesota in the daycare program. To deny that and have the Democrats close their eyes to daycare fraud in Minnesota is a travesty. Please read the report.
Clerk will take the roll. The clerk will close the roll. There being 55 ayes and 73 nays, the motion does not prevail. The A99 amendment is not adopted. There's an amendment at the desk. Representative Albright offers the following amendment. The clerk will report the amendment.
Albright moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A104.
The member from Scott, Representative Albright, to the amendment.
Thank you, Mr. Speaker. I would withdraw this amendment.
Representative Albright withdraws the A104 amendment. We have another amendment at the desk. Representative Heinzman offers the following amendment. The clerk will report the amendment.
Heinzman moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A95.
Mr. Speaker,
Representative O'Driscoll.
Mr. Speaker, I'd ask we temporarily lay this amendment over until we can get Representative Heisman back. He had to step out for an unknown reason at this time.
Very good. We'll lay that amendment over. There's another amendment at the desk. Representative Drazkowski offers the following amendment. The clerk will report the amendment.
Drazkowski moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A19-0472.
The member from Wabasha, Representative Drazkowski.
Thank you, Mr. Speaker. Thank you, members. We really haven't seen anything in this bill that addresses daycare fraud. We've seen some discussions of different miniature ideas that appear to help daycare fraud, but the only things I've heard from Representative Pinto are some ideas that bring additional consequences for committing fraud. Well, the fact of the matter is we have a system where people who are committing this fraud don't respect the laws of the state of Minnesota to begin with. So to add additional laws to people who are violating our laws is not going to work. We need a complete revamp of the system. Ideally, members, I would like to see CCAP go away. I think the money in the pockets of those families in Minnesota would go a lot further and be a lot more secure than what we have here. There's $250 million of this money that is at risk here in the state of Minnesota. This is the taxpayers' money, members. The other body has brought forward a proposal, members, that's reflected in this amendment. And so what I would like to do is discuss what they're doing in the other body and potentially put it in the bill. Because what this would do is actually provide for some fundamental change. Again, not the type of fundamental change I would like to do. It's more of a middle ground, if you will. But what it would do, members, is it would require the Commissioner of Human Services to bring forward a report and a recommended redesign of the CCAP program for the state of Minnesota. It would also require that that new design eliminates fraud, that it eliminates program inefficiencies and barriers to families entering the program, and the other items that you can see in the amendment. And then it would strike out or repeal the current CCAP program and replace it with the new CCAP program in 2022. Members, that's the amendment, and we have to do something different than we're doing. If you want the same results, just continue to do what you've always been doing, and we can't do that. So this brings us forward, brings forward a program redesign that has some actual integrity, hopefully, in it, and actually commits to some action that gives the taxpayers of Minnesota some hope. With that, Mr. Speaker, I'm wondering if Representative Representative Tabke would yield.
Representative Tapke is not on the floor at this moment.
How about Representative Hewitt? Would he yield?
I'm sorry, who was that? Representative Drazkowski?
Representative Hewitt.
I do not see Representative Hewitt.
Okay. I don't see anybody else I'd like to have yield, Mr. Speaker. Representative Christensen, would she yield?
Representative Christensen will yield.
She's my favorite New Democrat representative, Mr. Speaker.
Drazkowski.
Thank you for yielding, Representative Christensen. Representative Christensen, I hope and assume you've been following the debate. The members of your party is saying that daycare fraud is not a problem in the state of Minnesota. I suspect that your constituents disagree with that, but I want to know what you think. How much daycare fraud is too much on the taxpayers of the state of Minnesota?
Representative Christensen.
Thank you, Mr. Speaker. Representative Drazkowski. Probably any daycare fraud is too much, and that's why this bill is addressing it. Thank you.
Representative Drazkowski.
Thank you, Mr. Speaker. Well, I appreciate that response, Representative Christensen. I think my constituents and your constituents and probably constituents of every member here agree with you. Unfortunately, that's not what we're seeing. We have before us, Mr. Speaker, an amendment that would bring forward a redesign with lots of input from this body, from the Senate, and the executive branch as well. With that, I ask for a green vote. Thank you, Mr. Speaker.
The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, I rise in opposition to the amendment. I want to make sure that we note here that, well, first of all, this is directing the commissioner to have this major program redesign. There is no appropriation, no funding to support that. This presumably is one that could have in fact been ruled out of order under 4.03 in earlier discussions, but we'll move past that for the purposes of moving along. It's an unrealistic timeline getting this done in the next just few months. It could threaten federal funding that we could be receiving. You'll note that there's a phrase in there about meeting all applicable federal requirements, but then it appears to be a massive change with little thought, because later on it talks about getting waivers of federal requirements. My understanding is that's actually not a possibility with the federal government when it comes to the child care program. Ultimately, members, let's not punish kids. Let's not, if we're cleaning things up, Representative Drazkowski, let's not throw the babies out with the bathwater. Let's make sure that we're supporting kids and families and continuing to. Representative Drazkowski, I would say any level of misuse of funds is bad, is wrong, and is something that we need to go after, and this bill does that. And, Representative Drazkowski, any sense that we are not providing support for kids and families that need it is also a huge concern as well. We can do both those things, and this bill does that. Members, I'd urge that you vote this down. We have many provisions. Vote down the amendment. We have many provisions to address misuse of funds and to support kids and families as well. Thank you, Mr. Speaker.
Representative Drazkowski.
Thank you, Mr. Speaker, and thank you, Representative Pinto. Well, the items brought in the bill, Representative Pinto, are inadequate. They are nothing that is going to do anything to help daycare fraud, as far as I can tell, in this state. We need some sweeping changes. This would provide for that. Members, I've got a couple of handouts that were handed out, and the CCAP program, as I outlined earlier, is more and more going to big corporate fat cats throughout the state of Minnesota and throughout the country. That's been the trend. The more we develop regulations that make it harder and harder for family daycare operations to operate anymore, the more that these corporate centers are going to grow. Now, you'll see a list of those corporate centers in front of you. I've got a handout, or at least one of them. That's the New Horizon Academy. There's 66 sites in the state of Minnesota. I understand that 31 of them have maltreatment actions against them, yet they're still receiving the CCAP dollars at the very highest rate. Members, this is why our small family providers are getting clunked over the head and they're dying before our eyes. We've created a system that focuses on and supports government-run daycares and big honkin' corporate daycares. If you're one of those, you get the best rates and you get virtually no scrutiny from the regulators. If you're a small mom and pop daycare with 4 kids, or I don't even know how many are allowed anymore. Of course, that number's too small, and we need to change that. But if you're a small mom and pop daycare center, you get very low rates and you get the highest amount of regulatory scrutiny from the Department of Human Services and your county regulators. Now that is why we're having the daycare crisis in Minnesota. The other handout that I shared with you is actually captures some of the different citations that have happened with our small daycare centers in Minnesota, or family daycare operations in the state of Minnesota. So look at those. So they're getting cited for hard water stains in a sink. They're getting stated for leaves being in the entryway of the house or the daycare center, daycare home. They're getting cited for having a stick in the yard. This is our government in action, members. They're killing our daycare centers. Dried paint on paintbrushes. They're getting cited for that. They're getting cited for chipped paint on a bench. I think we all made it through, members, with chipped paint on a bench, but apparently there's some regulators out there that need to secure the future of their existence as a government employee. Scraps of paper on the carpet. These are reasons that small daycare operations in Minnesota, small daycare family businesses, are getting cited by the Department of Human Services. While that's happening, the big honking corporate ones are getting the highest rates and getting virtually no scrutiny and continuing to operate. If these big honking ones were the small daycare operations, they'd be closed down. But that's not what's happening. So, members, that's a piece of this, because so much of the CCAP dollars is going to the large corporate centers and funding them and funding their exponential growth in our state and country. So I hope, Representative Pinto, that your committee has a chance to address some of that, because that's where it's going. If you're government or if you're a big corporation, you're taking over daycare. Those two. The small ones lost 4,000 businesses in Minnesota since Parent Aware, this silly program that I've been against forever since it was incepted. 4,000 are gone. So we need to change the direction. Thank you for your time, Mr. Speaker and members. I'd appreciate your support on the amendment.
Any further discussion on the 0472 amendment? If not, all those in favor say aye. Aye. Those opposed say nay. No. The motion does not prevail. The amendment is not adopted. We have an amendment at the desk. Representative Heinzman offers the following amendment. The clerk will report the amendment.
Heinzman moves to amend House File Number 2414, the first and gross one as amended. The amendment is coded A95.
The member from Crow Wing, Representative Heinzman.
Thank you, Mr. Speaker, and thank you for the indulgence. This amendment is similar to my previous one. It redirects money. The $31 million redirects $31 million for reducing the CCAP basic sliding fee waiting list and provides that money to the Minnesota Department of Education for the Early Learning Scholarship Program. This funding would be prioritized to those families on the BSF waiting list so we can serve them with another program not constantly under investigation for fraud. This funding would also be available for children from birth to age 5, not yet enrolled in kindergarten. Until we are assured that the funding for CCAP is not being wasted or stolen through fraud, I would suggest that we allocate these funds to other programs that we absolutely know are serving these families. I'd also request a roll call, Mr. Chair.
Roll call's been requested. Seeing 15 hands, there will be a roll call. Any further discussion? The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. And members, it's true that this is similar to the earlier amendment and that we've got a trade-off between programs here. I'll just point out that the Child Care Assistance Program plays a role that the scholarships cannot. They each have a role and provides flexibility for families to get them out of poverty and to be working or going to school and continue on that path. Members, I would urge you to vote the amendment down. We can address misuse of funds, which we're doing, while at the same time lifting up kids and families, and vote this amendment down. Thank you.
Representative Heinzman.
Thank you, Mr. Speaker. Once again, overall, this bill raises health care costs. It cuts funding for nursing homes. I mentioned it before. In my own district, one of the biggest conversations in the last few years has been an appreciation for the increases that Republicans passed. Here we are cutting nursing homes by $68 million. And we continue to have a problem relative to fraud and waste in the CCAP program. So I would request a green vote on this amendment. I'd appreciate your support.
The clerk will take the roll. The clerk will close the roll. There being 54 ayes and 73 nays, the motion does not prevail. The A95 amendment is not adopted. There's an amendment at the desk. Representative Schumacher offers the following amendment. The clerk will report the amendment.
Schumacher moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A169.
The member from Rock, Representative Schumacher.
Thank you, Mr. Speaker and members. The A169 amendment requires DHS to audit all the state's forecasted programs and determine the extent of potential fraud in medical assistance, CCAP, housing supports, MFIP, and the other forecasted programs. The audit must come back with recommendations that will help us actually reduce fraud. Every dollar of fraud that we prevent is a dollar that we could reinvest in the programs. A dollar that we could invest into roads and bridges, a dollar that we could invest into education. We should make sure that our public programs are as free of fraud as possible, and this would be the first step in ensuring that we do that. Members, I'd ask for your support.
The member from Hennepin, Representative Loeffler.
Thank you, Mr. Speaker and members. This amendment would duplicate the assigned responsibilities of the legislative auditor. We currently have it in statute that to ensure continuous legislative oversight and accountability, the legislative auditor shall give high priority to auditing the programs, services, and benefits administered by the Department of Human Services. The audit shall determine whether the department offered programs and provided services and benefits only to eligible persons and organizations and complied with the applicable legal requirements. The auditor has done a good job on this and will continue to do that. And the amendment, while seemingly designed to promote accountability, exempts the contract that it requires from all of our normal contracting laws that prevent insider dealing and other contracting issues. I urge a vote no.
All those in favor say aye. Aye. Those opposed say nay. No. The motion does not prevail. The A169 amendment is not adopted. There's an amendment at the desk. Representative Munson offers the following amendment. The clerk will report the amendment.
Munson moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A204.
The member from Blue Earth, Representative Munson.
Thank you, Mr. Speaker and members. We're going to talk about something a little different here. We're going to talk about CCAP fraud. But this is the last amendment I think you're going to hear today on CCAP fraud. But as a member of the Newhouse Caucus, we're taking a little different approach to this. All the amendments we've talked about today is identifying fraud, rooting out fraud. We know there's fraud in the system. This amendment's actually going to prosecute fraud. When we identify fraud, and fraud cases in CCAP are very difficult to prove. And if Representative Hassan was on the floor, I'd like her to listen to this because it's very difficult to prove a case of fraud in CCAP because you actually have to staff people all around the building to make sure children aren't coming and going. There's a lot of suspected fraud, and there are many cases that have been prosecuted. But prosecutors, when they're handed these cases of fraud, have to weigh them against a very difficult fraud case to prove, to try to recover, or have a judgment against the center and say you have to pay back millions of dollars. Or they go after drug dealers and other violent crime. And so prosecutors are choosing to go after the violent crime versus fraud. This bill, it creates a special prosecutor and moves the office of the OIG outside of the DHS so it can work independently, but creates a statewide prosecutor for welfare fraud of all types, of medical assistance and CCAP and everything else that we're using taxpayer dollars for to go after this fraud. And it coordinates the efforts of all counties. Because when the second OLA report came out, they found that when they asked, show us all the fraud cases that you're investigating, they didn't even have a system. They didn't have an internal system that you can use to track cases. They didn't even have a spreadsheet. They had some emails and some notes from phone calls. And yet, in that instance, they were still able to prosecute over a dozen cases and $6.5 million in fraud, successfully prosecuted. So members, this bill would create an independent investigator and an independent prosecutor, and they would report to a board that's outlined in this bill. We call this board the Board for Restoring Public Trust, because that's what this is really about. The public has lost our trust with their dollars because they see a large percentage of this money being wasted. And you have the investigators in the first OLA report, it said over half of the CCAP dollars they suspect are being used fraudulently. That's unacceptable. The periodic data matching program that was put in, and it's taken years to get off the ground, that is a successful use for identifying fraud. And the report that came out recently said of the medical assistance, or the Medicaid dollars that are being spent in our state, over 10% is fraud. The people are not qualified to receive it because of the numbers that they reported on the application don't line up with what's being reported, as Representative Zerwa said. And for those watching at home, 1% fraud of medical assistance is $100 million of your money. So over 10% fraud is $1 billion a year in fraud. So a lot of these bills today have talked about how we can identify fraud. There's already fraud identified. Let's talk about prosecuting people so we can stop people thieving in our taxpayer dollars. This is what people want to restore public trust, is they don't want just a bunch of boards and blue ribbon committees identifying where there could be fraud. Let's actually stop it. Let's take action. And so this bill is going to do that. And members, I would like your support on this bill today. It will actually show the public that we're taking action in prosecuting and not just identifying fraud. So thank you, members, and ask for an affirmative vote.
I'll call on the member from Ramsey, Representative Pinto.
Thank you, members, and I'd urge a no vote on this. I'll point out that it takes funding from another area but doesn't specify exactly how the funding should come from. Representative Munson referenced a case tracking system, the need for that. If you support that, support the bill, because we put the case tracking system in there as well. There may be a conflict with federal law in terms of the Medicaid funding. We can discuss that, and would have to go to the Government Operations Committee if this is added. This is a board that crosses between departments. Bottom line is, vote it down. Thank you, Madam Speaker.
There is an amendment to the amendment, so the clerk will report the amendment.
Drazkowski moves to amend the Munson Amendment to House File Number 2414, the first engrossment, as amended. The amendment to the amendment is coded A206.
The author of the amendment, Representative Drazkowski, will speak to the amendment.
Thank you, Madam Speaker. The amendment to the amendment simply inserts the $500,000, the amount necessary in the bill. Urge your support.
Discussion to the amendment, Representative Pinto.
And Madam Speaker, members, no objection to the underlying amendment being in the form the author wishes. Thank you.
Any other discussion to the amendment? All those in favor say aye. Any opposed, nay? The motion prevails. The amendment is accepted. To the underlying, to the amendment as amended. Any further discussion? Seeing Representative Munson.
Yep, it sounds like we're on a roll, Madam Speaker. So affirmative vote again, please. Thank you.
All those in favor say aye. Any opposed, nay? The motion does not prevail. The amendment is not adopted. There is an amendment at the desk. Representative Drazkowski offers an amendment.
Drazkowski moves to amend House File Number 2414, the first engrossment, as amended, and the amendment is coded A94.
The author of the amendment, Representative Drazkowski, will speak to the amendment.
Thank you, Madam Speaker. Members, our medical assistance dollars are paid to large insurance companies throughout the state of Minnesota who take that money then and use it to cover the public program recipients. What they don't have is the type of controls that are in place in the private sector. In the private sector, or even some of, even our public sector health care benefits that members here have, we are required, and others in Minnesota are required, to show that they're not duplicating benefits elsewhere and to prove that they're actually alive and at that address. Now, members, that's not the case with this arrangement of these capitation payments that go out to these insurance companies in huge amounts, not to find out whether or not the individual is even alive or they're at that address. They may have moved to another state. They may be covered under a different insurance company, also under medical assistance, or they may be covered under Minnesota Care or a variety of other things. But the insurance companies are never told and forced to check out and make certain that the people that the taxpayers of Minnesota are paying for are actually receiving the benefits. There's duplication of payments here, members, that we have to find a system. This is one to do that, and I would encourage your support for the amendment. Representative Liebling, you and I have talked about some of this in the past, and I hope that you're supportive of this amendment. It's one that will get us to the point where insurance companies are actually going to be held accountable for the people they're supposed to cover. I'll remind the members that there's no downside at all for the recipient. So if the argument is the recipient is not going to be covered or wouldn't be sure if they're covered, all they have to simply do is go into an emergency room and they'll have the best care of anywhere in the world. It'll cost them nothing. It'll be a Cadillac coverage, and they'll be, the good part about that, members, is their address would be finally surface again so that the insurance companies could bring that forward. But this, the I'm not a robot language, makes it certain that the people who the taxpayers of Minnesota are delivering these payments for are actually there and alive and needy of the coverage and not duplicating coverage elsewhere. I encourage your support for the amendment, and I ask for a roll call, Madam Speaker.
Roll call being requested. I'm short. Okay. Seeing 15 hands, there will be a roll call. Discussion to the A94 amendment. Representative Loeffler.
Well, thank you, Madam Speaker and members. And this proposal would turn our health plans into another step of eligibility verification for people who are sick, who are disabled, who are elderly, or otherwise have stepped up to be covered by our public health programs. It would be duplicative of the current work of DHS in the counties who verify eligibility. They do that regularly through both paper and automatic processes. For example, right now, death records and death reports are automatically checked against all of the eligibility systems of DHS. We could just put that aside. Other states had problems with that, but we didn't. It distracts money from health care. There's no reimbursement for this to the health plans, so it distracts from the money that we're giving them for health care to instead administrative processes where they're going to have to send out mailers and collect things and send them back to DHS, and there's no need for this. I urge a no vote.
Representative Drazkowski.
Madam Speaker, would Representative Loeffler yield?
Representative Loeffler will yield. Representative Drazkowski.
Thank you, Madam Speaker. Representative Loeffler, can you tell us what verification that the Department of Human Services now has in place to verify that someone who is covered under these public programs and receiving the programs through an insurance company that has received these huge amounts of payments for many, many, many people is actually not covered by another insurance company for medical assistance, is not covered by Minnesota Care, and has not moved out of the state?
Representative Loeffler.
Thank you, Madam Speaker. And Representative Drazkowski, I believe that the systems, the Department of Human Services do have single identification, match-up social security names, et cetera, and so that people would not be on multiple public enrollment health plans and programs. Whether or not we have the ability to cross-match with the private insurance, there is so much work involved in applying for public health programs. You have to give copies of your tax reports, birth certificates, paid checks, stubs, et cetera, that if someone's gone through all that work and finally gets a job that's got health insurance, I know they'll be glad to step out of that system.
Representative Drazkowski.
Thank you, Madam Speaker. Well, Representative Loeffler, there isn't any. And you're right, there isn't any verification. They don't have a system. There are arguably thousands of Minnesotans that either are no longer Minnesotans because they moved to South Dakota to avoid our taxes, or Florida to be warmer, or whatever they've done, or they're on another public program that's duplicating, and Minnesotans are paying twice for that individual. So there isn't one. And that's the reason for the amendment. Madam Speaker, thank you. I encourage a green vote on the amendment.
Discussion to the A94 amendment. Representative Quam.
Thank you, Madam Speaker and members. And I believe the representative that was speaking earlier was present in the committee meetings and was around. I know she was around when we had the legislative auditor did a report. Remember, MNsure's back end was broken. Their verification was broken. They were trying workarounds that were using paper. And I believe there was a legislative audit report where they did a sampling and found several $100 million that was fraud. It was wrong. The systems weren't catching it. And to say that, oh, we were fine, is to ignore actual data reports and committee presentations of those reports of past fraud and issues. And frankly, we should not have our head in the sand. We should not continue to think that we don't have large amounts of fraud, waste, and abuse. And this bill is not solving that issue. And some of the amendments we're hearing are trying to make it better. We're looking at other approaches. But you've got tens of billions of dollars, and you have hundreds of millions at least where we've got fraud. And I'm not saying that we've got a silver bullet, but we need to start putting ammo into the belt.
Discussion to the A94 amendment. Representative Loeffler.
Thank you, Madam Speaker, and I don't think this needs to turn into a debate about things, but I do need to correct the record. Yes, I was in the hearings with the legislative auditor, and he did a selective sample, and he cross-matched it with income tax data, which only he has available. Counties, DHS, no one else has information to it, and admitted in the discussion in committee that someone who was earning, say, $35,000 last year, but got laid off at the end of the year, perhaps as a diabetic, totally dependent upon that, his unemployment insurance would not cover the next refill he needed for insulin. If he applied for assistance with no income, no savings, and an immediate medical need, he would be eligible, and that could not be that was not the next steps that the auditor was not able to take in looking at that issues, and it was speculative, and that was put to rest. Thank you.
Representative Drazkowski.
Thank you, Madam Speaker. Well, members, waste, fraud, and abuse is rampant in our government and state of Minnesota. The DHS programs, whether you're talking about Medicaid, which, if you remember, the Office of the Legislative Auditor brought his audit forward in 2016, measuring 2015 recipients, 40% of the recipients, out of the 40% of the recipients, through 5 months of the year, there were somewhere between $115 million and $271 million of waste. Now, recently, we've seen the memo. Representative Munson talked about it. There's $10 billion a year of state and federal money spent on Medicaid in Minnesota. $10 billion. And the memo from the department said there's a 10% error rate. That's $1 billion just in Medicaid. And then we've got up to $100 million of CCAP fraud, $83 million of SNAP fraud, $31 million the department doesn't want to collect in premiums that are overdue. Where are the controls, and who's standing up for the people? Members, we are paying these huge pooled capitation payments to the huge insurance companies, Blue Crosses, Health Partners of the world, and they're getting by with these huge amounts with less liability than they communicate in the contract that we bring forward for them. Now, Democrats, you're not for that. The taxpayers are getting ripped off, and so are the public health recipients. This is a solution that will do what everywhere else except the public programs it's required. We're required to say, well, does your spouse have coverage? Are you getting insurance somewhere else? And you actually have to sign the form and send it in order to get the health benefits. This would hold the insurance companies accountable. Appreciate your support on the amendment. Thank you, Madam Speaker.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. There being 53 ayes and 73 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. Representative Miller offers the following amendment. The clerk will report the amendment.
Miller moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A19-0460.
I call on the member from Representative Miller.
Thank you, Madam Speaker. Members, we've had a great conversation on daycares, those that watch our young children. Very spirited, a lot of energy. I want to personally thank my member to my left, Representative Drazkowski, who has a lot of passion on these subjects. This issue is very important to me, and I hope that I can exhibit at least a portion of the passion that people like Representative Drazkowski exhibit here in the chamber room. I'm looking forward to the day when this bill that I'm presenting now is held as a standalone bill on the House of Representatives. I'm looking even more forward to the day when we pass this off in unison. Speakers and members, for many years, the argument over abortion has raged in our society. Battle lines have been drawn, talking points have been exhausted. Political campaigns have been won and lost because of this issue. And yet, for the most part, the people who have opinions on one side or the other are not moved by the arguments on the other side. And so the debate continues. I personally will continue to speak for the millions of voices who have been silenced by this atrocity and for those who are under threat of their lives in the future. I will not stop until this ends in our country. And I know many of you will fight for the ability of a woman to terminate her pregnancy at the same time. So how do we move forward? Members, it's time the conversation changes, and my amendment will do that. Members, our country does accept that there are limits to when a woman can have an abortion. Roe v. Wade determines there's a time when a state can limit them. There's legislation here in the body and elsewhere, and I think Representative Scott, who's going to be presenting that shortly, that makes it illegal when the infant can feel pain. Let's at least stop it when they can feel pain. Some legislation says a child has legal rights as a citizen from the time they are conceived, which I personally agree with. And then there are some who believe the baby can be terminated up until the minute it's born. I don't like them so much. Members, regardless of where you stand on whether a child can be terminated in the womb, the far majority of people in the United States believe there should be limits on when. My amendment picks a logical, science-based landing spot. I'm simply using what we as a human being say when life starts and stops. Members, the medical profession bases life on whether a person has a heartbeat. If someone is brain dead, but they still have a heartbeat, they are considered alive. Time of death is determined when a heart stops. So if life ends when a heartbeat stops, doesn't it only stand to reason that it begins when it starts? Members, my bill simply states that if a woman goes to an abortion clinic, the doctor must first check to see if there is a heartbeat. If there is one, they cannot abort. Death or irreversible damage of a major bodily function of the mother is exempt. Members, I hear time and again that Minnesota is a leader in the nation in caring for those who are the most vulnerable. Representative Liebling, that's largely what you're saying in your bill. There is no one more vulnerable than an infant, than a preborn infant, where they can't even speak for themselves. There are already states who have passed this legislation. Let's join them, and let's get this right. Madam Speaker, I ask for a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call.
Thank you, Madam Speaker.
Discussion to the A19-0460 amendment. Representative Lucero.
Thank you, Madam Speaker. On the topic of life and the most vulnerable among us still in the womb, I'm a strong supporter. We need to fight those that don't have a voice. And this amendment seeks to confirm the truth that life exists in the womb. And one of the things that helps to point to this truth is found and recorded for us in Scripture. And specifically, I'm thinking about the story of when the mother, Virgin Mary, went to visit her cousin Elizabeth. And her cousin Elizabeth, pregnant as well with John the Baptist. And so the Virgin Mary comes into the presence of Elizabeth, and when she does so, Scripture records that the baby, John the Baptist, 6 months old, leapt in her womb. When the Virgin Mary, pregnant with Christ, was in her presence. John the Baptist at that time was about 9 inches long. In the womb, it is the reality that life exists in the womb. It is our obligation to accept this truth, to protect life in the womb, and for this reason, I would highly encourage a green vote on this amendment. Thank you.
Discussion to the A19-0460 amendment. Representative Morrison.
Thank you, Madam Speaker. Members, this amendment would effectively ban abortion in Minnesota. It would ban it before most women even know that they're pregnant. It disregards the U.S. Constitution, the Minnesota Constitution, decades of constitutional interpretation by both the U.S. and Minnesota Supreme Courts. It interferes with the sanctity of the physician-patient relationship, and it infringes on a woman's right to health, safety, and privacy. The Minnesota Medical Association and the American College of Obstetricians and Gynecologists all oppose this legislation. Members, I urge you to protect women and vote no.
Further discussion to the A19-0460 amendment. Representative Miller.
Thank you, Madam Speaker. Representative Morrison, I believe you're a doctor, correct? Okay. Representative Morrison, as a doctor, you just said that there's a heartbeat. People listen to what I just said. There is a heartbeat of that baby inside the mother, oftentimes before she even knows she's pregnant. Okay? There's nothing in my bill that threatens the life of that mother. There's nothing that threatens her individually. When I say we have to change the conversation, I wasn't going to bring this up until Dr. Morrison, Representative Morrison, I apologize, a different room, brought this up. One of the arguments that I get is you're attacking women, or said different ways, you're attacking women, or you're not letting them choose what goes on for their own bodies. Members, this organism inside them that I call a child, that you might want to call a fetus, you might want to call cells, whatever, has a heartbeat. It's independent of the heartbeat of the mother. It's a separate living being, okay? So when we talk about my body, my choice, I really don't have a problem with that. This is not their body, so it's not their choice.
Further discussion? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 58 yeas and 69 nays, the motion does not prevail. The amendment is not adopted.
Madam Speaker.
Madam
Speaker.
Representative Davids.
A point of
For what
personal
purpose?
privilege.
State your point of personal privilege.
Members, I owe this body an apology. At 3:32 p.m., there was some words uttered in this body that said Republicans are Islamophobic and racist, and it was said with quite a bit of anger. Now, I apologize to this body because I should have been out of my chair citing a point of order under Section 123. If you read Section 123, use of disorderly words in debate, no person may use indecent language with reference to the body or its members. When disorderly words are used by a member in debate, notice should immediately be taken care of, and I wasn't immediate. We went on to the next amendment. I think Chair Marquardt, as Speaker, handled the situation very, very well, but I'm speaking for myself, and I think everybody in this body. I love this body. I am not a racist. I am not Islamophobic. So for someone to state that bluntly, and for me not to get out of my chair quick enough with Masons, shame on me. I apologize for that, because it should have been noted, it should have been put in the record. Some very, very harsh words that are simply not true. In 1963, my parents went to Korea and adopted a handicapped brother. I didn't think he was handicapped, he was a tough guy. And a sister, Korean. Where's the racism there? My daughter and her husband, one of my daughters and her husband just got back from China with a 6-year-old special needs child. Where's the racism there? Members, this body is too important to have such language used on this floor. So I apologize to the body for not getting up quick enough on Mason Section 123, but I will next time. Thank you, Madam Speaker and members.
There's an amendment at the desk. Representative Scott.
Scott moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A159.
The author of the amendment, Representative Scott, will speak to the amendment.
Thank you, Madam Speaker. And before I forget, I would like a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call. Representative Scott.
Thank you, Madam Speaker. Members, this is the Pain-Capable Unborn Child Protection Act in amendment form. And the substance is really all there in the title. This amendment will protect unborn children when they can begin feeling pain. Members, we know that at 7 weeks, an unborn child has fingers, toes, and ears. We know that at 8 weeks after fertilization, preborn children react to touch. Their vital organs are functioning, their stomach, kidneys, brain, and heart. We know that by 20 weeks, preborn children have hair and working vocal cords, and they can suck their thumb. And if you have been blessed to carry a child, we know that they can kick pretty well. At 20 weeks, these preborn babies already have pain receptors throughout their body, and those nerves already link those receptors to the brain. 20 weeks. These preborn babies react to pain by recoiling. We know that painful stimuli create stress hormones in unborn children, and that painful stimuli are associated with long-term negative effects, such as altered emotional, behavioral, and learning disabilities in life. We know that doctors routinely use fetal anesthesia when conducting surgery on unborn children in order to reduce stress hormones. Simply, we know that unborn children can feel pain 20 weeks after fertilization. The medical science is substantial. The advancements in medicine and in ultrasound technology have helped us understand more about babies in the womb. The advancements since Roe v. Wade in 1973 are profound. And it causes me to think of a scene from a recent movie that I went to see called Unplanned. And it's about a woman that managed a Planned Parenthood abortion clinic for about 8 years. And in that time, over the time that she was there, she was never asked to be in the procedure room when an abortion was taking place. And the opening scene of the movie, and I'm sorry for those of you that haven't seen it that may want to, spoiler alert, but at the opening scene of the movie, they're there at the Planned Parenthood on a Saturday, which is a very busy day at Planned Parenthood, and she's asked to come into the procedure room to help guide the doctor in finding the baby in the womb. And for the first time, she takes the transducer, which is like the wand that they use for an ultrasound, and she had to locate the baby in the mother's womb. And so she found it. And then the doctor could see that on the screen while she held that device there on the mother's stomach. And he stuck the suction instrument up to the womb and poked the baby, and the baby recoiled. The baby recoiled from the pain. And then the baby moved out of the way and tried to escape this suction instrument. And you see in live ultrasound, Madam Chair, Madam Speaker, it seems a little noisy in here.
Members, take your conversations to the alcoves or the retiring room.
Thank you, Madam
Representative
Speaker.
Scott.
So what you see then is the full abortion. It's very hard to watch, but they do suck the baby out of the womb, and then there's just complete darkness in the womb. So members, we know that we have these advancements in medicine, yet in Minnesota, it's still perfectly legal for women to receive an abortion after 20 weeks. And this bill would change that. You know, Minnesota was one of the first states to adopt a cause of action for both a mother and the unborn child in cases of homicide or vehicular homicide, those sorts of things. Minnesota was a leader. And they identified that child in that womb had rights. And so they created a right of action for that child. This bill prohibits abortions 20 weeks after fertilization, unless the woman's life is at risk. This bill further requires that if an abortion is performed after 20 weeks, the physician must take steps to provide the best opportunity for the unborn child to survive. With states like Virginia taking steps this year to allow doctors to abort children at birth, we should ensure that Minnesota protects these preborn children that experience excruciating and often prolonged pain in abortion. We must catch the law up with the reality that a preborn child at 20 weeks post-fertilization feels pain, and we need to recognize their humanity. And with that, Madam Speaker, I would ask for member support.
Discussion to the A159 amendment. Representative Mueller. Representative Morrison, excuse me.
Thank you, Madam Speaker. Members, I find this to be a particularly cruel amendment. It bans abortion at 20 weeks of pregnancy and makes it a felony for a doctor to provide care for her patient. These are very rare, often complex and heartbreaking situations. Almost always, these are dearly desired pregnancies where something has gone terribly wrong. Often, they involve fetal anomalies that are incompatible with life. In these tragic situations, care should be medically appropriate and compassionate and should focus on what the patient feels is best for her and her family. Sometimes it's necessary when complications in pregnancy arise that severely compromise a woman's health or her life. Although the numbers are very small, these women need and deserve care. This amendment would put physicians in the untenable position of acting in the best interest of their patients or facing criminal prosecution. The Minnesota Medical Association and the American College of Obstetricians and Gynecologists oppose this ban because it would limit the ability of physicians to make decisions that are in the best interests of their patients. Members, I urge you to vote no.
Discussion, Representative Keel.
Thank you, Madam Chair. Representative Scott, Speaker Chair, excuse me, Madam Speaker. get it right. Thank you, Representative Scott, for bringing this forward. Members, I was blessed with a set of grandsons, twins. They were taken at 34 weeks because they had some complications that turned out to not be so serious. And I got to hold a 3-pound, 9-ounce baby boy. And they survived and did well. It was a real eye-opener to be at the Children's Hospital and watch all the little ones born and their struggles. And man, we are amazing at what we do as physicians. Thank you, Representative Morrison. There is so much we can do. What really disturbs me is that we think that at 20 weeks, we should remove a child, provide pain for them, and that's worse than maybe some of the challenges. I even have a niece that was told to abort her baby because we're pretty sure the baby has Down syndrome. And they confirmed it with some tests that were wrong, She would have aborted a young man who is now a healthy adult, and he was just fine. But more importantly, this bill is about protecting children from pain. And as I too, Representative Scott, have been to that movie, I read that book. It is really an eye-opener. And I encourage you all to examine what it is we're doing as a society. But I find it very interesting as a farmer. I've grown up with a lot of livestock. My sister-in-law does not so much anymore. They raise hogs. They don't do any procedure on an animal, whether it's to repair something or to slaughter them, without making sure they're not in pain. We do more for animals than we do for a 20-week infant. We should be shocked at what we do. This is serious. We know these children feel pain. We know they respond to voices. We know that they can feel pain. We are so blessed by having ultrasound. What a wonderful procedure we can do. We can see all kinds of movement in a child, their advancement, even being able to fix them and help them in uterine. We should not be aborting a 20-week-old infant. There are other ways to help families and provide what they need. Thank you, members.
Discussion to the A159 amendment. Representative Lucero.
Thank you, Madam Speaker. Unborn lives matter. Please vote green.
The member from Olmsted, Representative Quam.
Thank you, Madam Speaker and members. One question that I've got in my mind that has been brought up is, when is the unborn child the patient? At some point, that unborn child becomes the patient. And I would like us to consider that doctor-patient privilege too.
Representative Miller.
Thank you, Madam Speaker. First, Representative Morrison, you said that there may be fetal anomalies incompatible with life. You just described me, okay? Understand, I won't go through the whole story right now, but I can tell you that everything led to the fact that I was not going to be born alive. When I was born alive, they said I'm not going to live past the first week. When I lived past the first week, they said not past the first year. As far as I understand right now, and if I was, I'd be missing limbs, I'd be missing sight, I'd be missing hearing. And look at me how. I have my limbs, I have my sight. I was wondering if Representative Morrison would yield to a couple questions.
Representative Morrison will yield. Representative Miller.
Representative Morrison, I assume that you've delivered children. This isn't a question, but I want to put it in context. I understand you've delivered children, correct? Or let me rephrase that. You have examined women who are pregnant, correct?
Representative Morrison.
Madam Speaker, Representative Miller, that is correct.
Okay, will she continue to yield?
She will continue to yield. Representative Miller.
Thank you, Madam Speaker, and Representative Morrison. When you are with a woman who is going to have a child, and you do that ultrasound, what do you call that inside? What do you see in the ultrasound? What do you tell the mom that they see?
Representative Morrison.
Madam Speaker, Representative Miller, I'm not sure.
Do you call it a fetus to them? Do you say it's your child? Do you say
It
it's your baby?
depends entirely on the clinical situation, the patient, how far along in the pregnancy, any number of things.
I apologize, Madam
Representative Miller.
Speaker. I was just reminded that the flow is going poorly. I apologize. Thank you, Madam Speaker. If Representative Morrison would yield to one more question.
She will yield. Representative Miller.
Thank you, Madam Speaker. Representative Morrison, in my bill, you stood up and opposed 18, I think it's 18 days is the number that I've heard, as not being a good time. And if we remember, even the U.S. Supreme Court does say we can determine things based on how long, just not whether or not you do it. And now, Representative Scott is saying, well, not 18 days, how about 20 weeks? We're starting to bargain here a little bit. So, Representative Morrison, I want to know where this stops with you. Would you say that you do or do not support the restriction, let me rephrase that, sorry. Would you say that you do or do not support the position of Governor Northam in Virginia at 0?
Madam Speaker, point of order.
Describe your point of order, Representative.
Madam Speaker, I rise to a point of order under Mason Section 124 regarding the subject of debate. It is not appropriate to question anybody's motives in debate, and our purpose of debate is the motion in front of the body, not individual members' motives.
Madam Speaker,
And Representative Miller.
I'm not hearing any motives. I'm asking where this is a number, this is a quantifiable thing here. So she had stood up and opposed 18 days. She has
Madam Speaker, point of order.
State your point of order, Representative Hoverson.
Thank you, Madam Speaker. I just wanted to be very clear for the body and for any members who are speaking that we, under Masons, we need to be addressing the issue before the body. The issue before the body is Amendment 159, and any member's motives or interests are not of subject of debate, and I ask members to stick with the subject of debate as per our rules. Thank you, Madam Speaker.
Okay.
Thank you, Representative Halverson. We will just remain on this topic. We will, Representative Miller has the floor. He has asked a question.
Madam Speaker, perhaps I'll rephrase the question.
Representative Miller.
Madam Speaker, I think this is fair to this bill. We're talking about 20 weeks here. I won't refer to 18, I won't refer to the other ones, just the 20 weeks. Representative Morrison, is there a time in between 20 weeks and after that you think there is an inappropriate time to be aborting a child?
Madam Speaker, point of order.
Representative Winkler.
Under Mason's personalities in debate, Representative Miller, I understand that you want to have a conversation about abortion and about limits. However, to point the question directly at a member for their opinion about how far is too far in a public policy debate goes beyond the scope of the debate in front of us. We have to focus in on your views, not grilling other members on their individual personal opinions or their professional practices in this regard.
Madam Speaker, point of order.
Representative Drazkowski.
Madam Speaker, the custom and usage of this body has provided for this type of discussion with members for each of the 12 years that I've been in this body. The custom and usage provides for this and many, many, many more types of discussions that of the like that Representative Miller and Representative Morrison have been having. For members, and with all due respect, Mr. Majority Leader, you have been here too. And I remember many, many more things that are much closer to personal discussion than this is. The custom and usage of the body trumps what occurs in Masons, and I would ask, Madam Speaker, that you take that in your consideration in guiding this debate. Thank you, Madam Speaker.
Representative Miller has the floor. Representative Miller.
So thank you, Madam Speaker, and I'll wrap it up with this. I'm not going to get an answer, and there's going to be protection from her having to answer that. But I think the point has been made. Okay, I go back to what I said before. I don't think I'm in trouble here, but we're talking about days, which days here. And this is a discussion that we need to have as a society, as a state, and I certainly hope that we continue to have that. I will not stop. I know that people that oppose me will not stop, and I long for the day where the creator of this universe gets us corrected and we can move forward and be a better society because of it. Thank you, Madam Speaker.
We are discussing the Amendment A159, and to that, Representative Detmer.
Thank you, Madam Speaker, and probably people are wondering what is Representative Detmer standing up here for. Well, I think most of you know I'm pro-life. And probably what many of you don't understand about my family and I, our twin sons are adopted. We got the call right before Christmas, 42 years ago, that there was twins available to be adopted. We had to drive out to Arizona to collect these two little red-headed bundles of joy. And I just can thank that the birth mother at that time in her life decided to go through with the birth and put them up for adoption. And I would encourage everybody to get out and see this movie that's just been put out unplanned. My wife and I went together. It will change your heart. Because what we're talking today is about what's in your heart, not what's in your mind. Our twin sons, well, they went on to West Point Military Academy. They're serving their country, 4 deployments in Iraq, Afghanistan. We can be very proud of our people in our military. We're certainly proud of our 2 sons. In fact, they're lieutenant colonels. They outrank me. I'm a retired chief warrant officer. And when they come home with our grandkids, we have 7 grandkids, 1 on the way, which our daughter is expecting her 3rd. I tell them, well, you come home with the grandkids, I'm commander-in-chief when your mom's not there. I really encourage everybody here to get out and see this movie that's just been produced. It will change your heart, because that's what we're talking about here. Please vote green. Thank you.
We're on the Amendment A159 discussion. Representative O'Neill.
Thank you, Madam Speaker. I was sitting in Judiciary Committee and we were having a very small conversation about abortion, and Representative Liebling said something quite profound to me, to the whole committee. And she said, you know, none of us on this side of the aisle want abortion. None of us on that side of the aisle want abortion. That stuck with me. But what I'm confused by is when I look at the bill that we are debating, this amendment that we are debating, those words just aren't really backed up, and let me tell you why I say that. When the other side of the aisle cuts funding for alternatives to abortion, when you cut the funding for positive alternatives, let me say that again, when you cut the funding for alternatives to abortion, you are taking away a woman's choice. So you say, we don't want abortion. We've given you now 2 opportunities to vote with us to show that you don't want more abortions. But your bill does the absolute opposite of that. You literally are taking choice away from women. You're taking funding away from an incredible program that is an alternative to abortion. So members, join with us today. If really you don't want abortion, If that's really what you said, that's really what you want, then join with us and vote yes on the Scott Amendment. There's really no medical reason. Listen, the other thing I was going to say too is I think there was a misunderstanding of this amendment. And it's an incredibly important one because Representative Morrison said not only is this a particularly cruel amendment, but you also said that there wasn't an out if the woman's life is in danger. Please read the amendment. If the woman's life is truly in danger, then there isn't an off-ramp, there is an out. This is an incredibly important debate. That's why the chamber is so hushed and so quiet, because we're talking about life. And this is not a rare thing. This is not rare. 1 out of 4 women in the United States have had an abortion. That's not rare. 60 million children have been aborted since 1973. That's not rare. 1.4 billion, let me say that again. 1.4 billion children have been aborted worldwide that we know of. That we know of. We often talk about, oh, we don't have a workforce. We don't have enough people in Minnesota, in the nation. Well, we have 60 million lives that aren't here right now in the United States. 60 million lives that are not here right now because of someone's choice. So truly, if you don't want abortion, restore the funding to alternatives to abortion. If that's truly what you said and that's truly what you mean, restore the funding and join with us today and vote yes.
Discussion, Representative Franzen.
Thank you, Madam Speaker and members. So today I got a text message from a friend of mine who lives just outside my district, but his sister is pregnant. And he had shared with me weeks ago to pray for his sister and for that unborn child in the womb because that baby was in need of some surgery for a condition. And so today I received a text message and he said, "Thought you would like to know, my sister and the baby's surgery went well. They opened her up, took him out, fixed him up and put him back in for hopefully the duration." Yes. 21 medical professionals were on hand. His sister had a team, the team for a baby, and the premature birth team was standing by in case his sister's vitals dropped and they would have to deliver. This is life. So much so that the medical professionals recognize this life in the womb. Did the surgery put that baby back inside where it's going to stay nice and comfortable until it's time to come out and say, "Hello, world"? I had the luxury of myself having 3 children. Looking at me, you wouldn't think I have big babies, but I do. My first child, Helena, she turns 21 in May, 8 pounds, 5 ounces. And a few weeks ago, she was a little upset with me because I'm here and I don't see her very often even though I'm here. So she was a little upset with me. "Mom, you're in St. Paul and I don't get to see you very often." And I said, "Well, how about, I find a time and let's go see Unplanned together." She's 20. I was expecting her to say, "No, not into that," right? She shocked me and said, "Oh, me and Jason," that's her boyfriend, "just saw it last night." All on her own, without her mom pushing her to do it. And I said, "Well, what did you think?" My 21-year-old said it was eye-opening. As her mother, I was like just absolutely amazed that my 20-year-old went and saw this movie all by herself with her boyfriend. My second child, Carl.
The doctor assured me that he would not let me have a big baby, that he thought it was about 6 pounds. My Carl would be 6 pounds. And I was induced 2 weeks early. And when I delivered, Carl was 8 pounds, 9 ounces, 2 weeks early. And I said to the doctor, I thought you weren't going to let me have a big baby. And 8 pounds, 9 ounces. And then there's Colin. You probably all remember Colin. He's the one that loves to come down here. 8 pounds, 3 ounces. And now he is 12 years old, in the 6th grade. And members, you know, so he recently shared with me that he had to write a biography about somebody for one of his classes. And he chose his mother to write a biography on. Very cute, but this isn't the first time a student has written a biography about me. My son's friend did that last year, and all I could apologize to the mother and said, I'm sorry, there is a lot of material out there. Talking about abortions being rare, we would like to think that they are rare. Representative O'Neill said it best, 1 out of 4 women. That's not rare. What also is not rare is individuals who brag about their abortions. Hashtag shout your abortion. That's a real deal. It's a real thing. The founder says she set up shout your abortion, or hashtag shout your abortion, because I am not sorry and I will not whisper. Glamorizing something that will live with a woman and that choice to end a life forever. There's even a book. There's a website. All lies. There's nothing exciting about ending the life of somebody who cannot defend themselves in the womb. We hear a lot about a workforce shortage. That's why we need to bring and welcome more people into the state of Minnesota, right? There wouldn't be a workforce shortage, members, if we weren't aborting the very workers that we need today. With that, I thank my colleague, Representative Scott, for bringing forward this amendment. It's a difficult topic for all of us here in the room. But I will leave you with a quote from Dr. K.J.S. Anand when interviewed on ABC News, April 13th, 2010. No one is as blind as someone who does not want to see. Fetal pain does occur, and science would be better served if we acknowledge this capability of conscious sensory perception in the human fetus. Thank you, members.
Discussion to the A159 amendment. Representative Gruenhagen.
Oh, thank you, Madam Speaker. Just a short comment. Thank you, Representative Peggy Scott, for bringing this forward. Just a note from my jail ministry days, and I wasn't in jail, I did jail ministry, okay? But one of the prisoners that came to Bible study had murdered a pregnant woman. He was high on drugs, and he stabbed her, and I think she was in the 3rd trimester, and both her and the baby died. He was charged with 2 murders, members, okay? 2 murders. If that young lady would have gone into an abortion clinic like Planned Parenthood and had the baby murdered there, a medical professional would have been paid, and there would have been no criminal charges. If that sounds schizophrenic to you, it certainly does to me. Vote for Representative Peggy Scott's amendment. Thank you.
Representative Grassel.
Thank you, Madam Chair. Thank you, Representative Scott, for bringing this forward. I've spent a lot of time protecting people's lives, protecting those who cannot protect themselves in law enforcement. I'm a father of 3, newly a grandfather of a beautiful granddaughter. I do mission work abroad in other countries to help children. building schools, building classrooms for them, building homes, building churches, and teaching these kids about Jesus. Now, I've heard several times today Representative Pinto say we have a line of kids that need help. That's true. We have a line of children that need help. Madam Speaker, would Representative Morrison yield to a question?
Representative Morrison will yield. Representative Grassel.
Representative Morrison, this is just a scientific answer. And I'm just going to ask you, can two human beings who conceive a child together and you hear a heartbeat, can two human beings make something that is non-human?
Representative Morrison.
Thank you, Madam Speaker. Could you repeat the question, please?
Representative Grassel.
Repeat the question?
Sorry?
Repeat the question?
Please.
Okay.
Representative Grassel.
Thank you, Madam Speaker. Can two human beings who conceive a child together and you have a heartbeat, can they make something that is non-human?
Representative Morrison.
Thank you, Madam Speaker. I'm not sure the relevance to the conversation about the bill.
Thank you, Madam Speaker.
Representative Grassel.
That's kind of the answer that I expected I would get, because we are talking about a heartbeat, and we are talking about a human being. Just a simple question. And I'll just end with this. You know, do we think as a society that we will not one day be held accountable for the shedding of all this innocent blood? Members, there are so many children that are waiting for your help. We've already lost 60 million or more to the shedding of this innocent blood. I'm asking you to support Representative Scott's amendment. Thank you, Madam Speaker.
Discussion to the A159, Representative Nash.
Thank you, Madam Speaker. Well, members, a lot of you know that I have 6 kids. I should have 7. My wife miscarried at 16 weeks. Sorry. And in the hospital, while we were there, the nurse that was there after my wife miscarried said, "I'm sorry, your son is gone." I held him in my hands. Perfectly formed, fingers, toes, perfect. Except, as the nurse said, he was gone. So as I think about this, Representative Scott, I'll be pushing green because I'll be thinking of Peter. That's what we named him. So I would encourage you to think about him as well.
Representative Hertaus.
Thank you, Madam Speaker and members. Thank you for this discussion. I just wanted to comment that it's been 46 years since the Supreme Court decision Roe versus Wade. Many of you are younger than 46 years. Many of you weren't alive at the time of this conversation in which the Supreme Court made their decision. Many of us who were old enough remember those discussions, and many of us baby boomers, I would have to say to you, I think the vast majority of people hailed that decision as a right decision. This discussion is not about ending abortion, not at all. But as a young practicing nurse in an area hospital during this time before that decision in January of '73, there were a lot of procedures scheduled every day called D&Cs. And honestly, I was a little naive about exactly what that was until I was assigned to clean up after these procedures. Not too many of you have held that in your hands. Representative Nash just talked about his circumstance. What this discussion really is about changing your hearts and minds. In Minnesota, we have been first in the nation in a lot of things. And although we will always have the Supreme Court decision, which, because it was decided that the Constitution doesn't really spell out when life begins, is why the ruling is the way it is. And so that right will be protected, but we do have the ability, and I'm appealing to all of you from your own experience, for those of you who have had children and have seen that miracle of life, that it is about changing your heart and your mind. That's really what this is about. And we could be first, not first in the nation, but we could join in the nation in stating that 20 weeks is what our moral conviction in Minnesota is. So to that, members, I just leave you with that thought. We have the ability to add this amendment to this bill and protect life from 20 weeks on. It's not an unreasonable request. It gives plenty of women who want to manage their health, and there's exceptions for medical emergencies, but after 20 weeks, we should respect the fact that life is life. And a comment was made earlier about protecting the rights, reproductive rights, and protecting women and women's health. I would just point out that statistically, 50.4% of all of these terminated pregnancies are women one day. Thank you.
Seeing no further discussion, Representative Scott.
Thank you, Madam Speaker, and thank you for a good, respectful discussion today, members. And I just wanted to address some of the arguments that Representative Morrison mentioned. And one of those, I just want to clarify what the bill does and does not do. The bill in no way criminalizes the woman who gets an abortion. It criminalizes a doctor who knowingly, and the language says they must know, based on good medical evidence, that they are aborting a child that is 20 weeks or over. So the felony is for the physician who acts against this law. And members, I don't know how many of you know this, but it's a felony in the state of Minnesota to kill a police dog. I hope that puts this in perspective. And as far as Representative Morrison was talking about the woman being the patient, and Representative Franzen gave that wonderful illustration of the surgery that was able to be performed on this child before it was ready to be born. Bring him out, do the surgery, put him back in, it's amazing. But I can guarantee you that when that surgery was done, that baby was the patient. And it seems to me that the baby is a patient if it's a wanted child, but if it's not a wanted child, it's a fetus. It's something other than a human being. And members, what we're trying to tell you with this information and with this amendment and the medical science that backs it up is that this child at 20 weeks it's 100% human. It feels pain. It feels pain. You know, my son a few years ago, when he was probably 19, maybe he was 20, had a lawn mowing accident. And 3 of his fingers, he lost parts of 3 of the middle fingers on his right hand. And I happened to be there at the time. It was something to behold when I'm not used to seeing that sort of thing. But I can tell you that he was in excruciating pain. He was in excruciating pain from having those fingers chopped by a lawnmower. What we're asking for in this bill is to give the unborn child in the womb this. By the way, my son was able to have painkiller. What we're asking for is when a child can feel that pain, the pain of an abortion, where they're wrapped, where they are cut from limb to limb, or they're sitting in saline solution for an hour while the skin burns, until they're dead. We're asking for that respect, to treat that child with dignity. I'm not in any way diminishing difficult choices that women have to make, especially when they've heard that their child may not survive outside of the womb. Many of you know Mary Liz Holberg that used to be in this chamber. And she has a brother. Her parents used to take in foster children, and they got a call one day. Hey, will you folks take this baby? He's not expected to live long. He's got a lot of health issues. But we want him to feel loved and humanized and dignified. Dignify his life. And so they took this baby. And that baby, when she gave testimony to this a few years ago, was 40 years old. He was 40 years old and a blessing to their family. It is not an easy decision when you've got a child that you know has issues, medical issues, but they are no less human. So members, I would ask for your support on this amendment. Thank you.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. There being 59 yeas and 70 nays, the motion does not prevail. The amendment is not adopted.